Hi guys, my name is Akash. Hope you're doing well. Today I'm going to give you the information about the measles outbreak in the US and Canada. As of March 30, 2025, measles cases are rising in both the United States and Canada. Health experts says this is happening because the fewer people are getting vaccinated, making it easier for the virus to spread. In the US, there are 483 confirmed measles cases in 21 states. This is a huge increase, like 360% more than before. Texas is the hardest hit with 400 cases, including 270 in Jennings County alone. The outbreak started in January and has already caused 2 deaths in Texas. Other states like Kansas, Oklahoma, and New Mexico are also seeing cases, and with New Mexico reporting 44 infections. Most of the infected people, 97%, are unvaccinated, and many are children between 5 to 19 years old. Experts blame the outbreak on low vaccination rates. Many parents are choosing not to vaccinate their children due to fear of misinformation about vaccines. In Jennings County, only 80% of residents are vaccinated, while the health officials recommended at least 97% to prevent the spread of measles. The outbreak is expected to continue for months, especially in areas where vaccination rates are low. Kansas state is facing another problem. Both measles and tuberculosis are spreading. On March 20, the state passed a new law giving the permission to parents to skip vaccines for religious reasons. Since then, more measles cases have been reported, mostly among unvaccinated children. Kansas also had 68 active cases of tuberculosis. Experts warn that this outbreak shows a weakening public health system. Now I'm going to speak about the measles cases in Canada. Canada is also seeing a rise on measles cases. As of March 6, 2025, there have been 227 cases. The states in Canada where this recent outbreak have happened are New Brunswick, Ontario, Quebec, and Manitoba. Most of the cases involve unvaccinated or under-vaccinated children who got infected in places like schools, daycare center, and social gathering. Measles spread easily and cause serious health problems. In some cases, it can be deadly. The Chief Public Health Officer of Canada is worried that fewer children are getting vaccinated, which make future outbreak more likely. Canadians are advised to make sure they are fully vaccinated, especially if they are traveling. Now I'm going to speak you about why measles are back. Measles was almost eliminated in both the US and Canada thanks to vaccines. However, in recent years, vaccination rates have dropped. Some parents are choosing not to vaccinate their children because of a false information about vaccine safety. Others face barriers like lack of access of healthcare or vaccine shortages. Additionally, international travel has brought measles back into North America as people get infected abroad and spread the virus when they return. Now I'm going to tell you about how to stay safe. Health officials in both countries are urging people to get vaccinated. They said babies aged 6 to 12 months traveling to high risk areas should get an early measles vaccines. Children and teens should get both doses of measles vaccines. Adults born after 1970 should make sure they had 2 doses. Adults born before 1970 should get at least one dose if they are not immune, especially if they are traveling. The return of measles is a serious public health issue. To stop its spread, communities must work together to improve vaccination rates and fight misinformation about vaccines.